Guys, welcome back to Medical Coding with Blue. Today's episode is all about, are medical coders certified by the state? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got an email about this question. I've actually gotten this question quite a few times, so I'm just gonna do an episode about this and put this to rest. So the email goes, "Hi Blue, I wanted to know if I start the AHIMA, the American Health Information Management Association, self-study program here in Illinois in January 2023, and if I move to another state, do you know if I have to transfer or take the CCA or the CCS test in that state? Could you possibly do a video on this topic for those who do the program in another state and then move before we finish the program? If you have a video on this, my apologies. I will go through the videos again. Thank you in advance." All right, so here's the thing. When it comes to getting your certification, you are certified by the associations. Whether you sit for a American Health Information Management Association credential, the CCS, the gold standard of medical coding credentials, certified coding specialist, the CCA, the certified coding associate, or the CCSP, the certified coding specialist position based, or if you are sitting for an American Academy of Professional Coder credential, the CPC, the certified professional coder, these credentials are good worldwide. You do not have to recertify in every single state. We are not doctors. We are not attorneys. We are not nurses who have to be certified by the states. We are certified by the associations. They are the ones who give us our certifications when we pass our exam, when we maintain our certifications, obviously by reporting the continuing education units. I do have a video about that if you are curious, and I will probably leave the link, if I don't forget, in the description box below. But that's the thing, guys. We are not certified by the state. It's a misnomer when you hear, "Oh, I'm taking my state boards." It's like nails on a chalkboard. I hate it when people say, "Oh, I'm taking my state board exam." We're not nurses, okay? We're not doctors. You know, we don't get certified by the state, guys. We are certified by the associations. And when I see like schools or just programs that are training for medical coding say, "Oh, we teach you for the state board exam," oh, it's just like, do you even know the product that you are selling? Because clearly you don't, because you would know that we are certified by the associations themselves. All right, and all you need to start is one certification. When you are out there and you are beginning brand new, I've seen this also pushed by some schools. "Oh, we prepare you for the CCS, the Certified Coding Specialist, and the CPC, so you can take them both and you can be ready for anything." That is not true, okay? When you look at these job listings, they're only asking you to be certified through one association, and that's it. And they're not asking you to have the CCS and the CPC. I have never seen that. Because if they do, then they clearly do not understand what these credentials mean. The CCS says that you have mastered inpatient coding and outpatient coding. The CPC only says that you know how to code outpatient. That is it. There are no inpatient questions on that exam. The CCS covers both of these things. The CPC only covers one. So that's the thing, guys. Don't be taken advantage of by these schools that are trying to push you to take all these credential exams that you do not need. You only need one. If you found that the CPT and outpatient coding was much easier for you, then go with the CPC. Or you can go with the CCSP. That is the credential with the American Health Information Management Association that covers just the outpatient side. Okay? It covers just outpatient. There's plenty of people who ask for it. And again, it doesn't cover inpatient. Now, if you are proficient in both the CPT manual and the ICD-10 PCS manual, then by all means, go ahead and sit for the CCA or the CCS. But just keep in mind this. Everybody says, "Oh, the CCA, the CCA." There's a lot of people who will hire the CCA. I know because I had it for 13 years and I did a lot with it. And I didn't let naysayers get in my way. I didn't let people put me down and say, "Oh, you can't, you can't." Oh, yes, I could. Because the CCA has the most domains of any medical coding certification exam. This says that the individual knows a lot and they are competent to enter the field that they can study, they can code for the inpatient side or the outpatient side. You have to know a lot, folks, okay? The CCS just says that you've mastered it. The CCA is a 2-hour exam, but don't let that fool you. Those 2 hours will pack a punch, and it's roughly 2 minutes per question. And with the CCS, that is a 4-hour exam. No, you want to talk about a tough exam. That is a very tough exam. It's very rigorous for a reason, okay? So again, it's the mastery of both inpatient and outpatient. But yes, so if you hear anybody say, oh, I'm taking my state board, correct them. Let them know it's not certified by the state, because when one person says it, everybody hears it, and the most incorrect information will travel fast. It's the right information that usually takes its time to get to people, or they're not listening, right? Because they think that it's more prestigious to have more credentials. I had one credential for many, many years. I had it for 13 years. I had the CCA. And there was nothing that could stop me as far as my working, right? And as far as doing the things that I did, nothing could stop me. Now, moving up, yes, that you do have to change, because that's entry level, and it was time to put it to bed, and that's exactly what I did. And so there's going to be a time where you're going to grow professionally, and you're going to move on from your credentials, and you're going to see, especially those of you who have multiple credentials and haven't gotten a job yet because people told you need them and you don't. Guys, you only need one when you're out there looking for a job. And when you're out there and you are starting to work, then you want to make sure that you are really looking around to see what it is that you really want to do. Some people tell me, well, Blue, I really want to do risk adjustment coding. Well, that's only diagnosis coding. And while it is very important, it's a very important part of what we do, you can do that certainly with the certification, like a CCS, CCA, CCSP, or CPC. You can certainly do it with that. You do not need the risk adjustment coder certification. And keep in mind that the risk adjustment time that you're going to be in there doing risk adjustment coding, some employers will not count that because you're not doing procedure coding or E&M coding. So because of that, it can really stunt your growth as a medical coder. So just be careful if you are in a risk adjustment position, and try not to stay there too long. Try to go and find another position where it's going to advance you, where you're going to have more opportunities. And while you may say, well, Blue, I'm comfortable where I am. If that's what you want, that's what you want. But in this industry, the best and the coders who get the most opportunity are the ones who are willing to, I don't know this, I just got to learn and work this. And those are the ones who get the most opportunity to do a lot of things. So I just encourage you all to do that. I encourage you to take chances as far as learning new things and be open to learning new things, because you certainly don't want to be stuck in one place and not have experience in doing a lot of different things, because you never know what you may discover that you may like. You may like to do other things, and you never know if you just stay in one place. Okay, so again, if you hear, that if you move to another state that you have to take another, no, we're not certified by the states. We are not. We are only certified through the associations, and that is who we report to when, as far as for CEUs and things like that. That is what we do, and that is who we who we are around, and so that is something that you all should know. But yes, when you hear that, ignore it. There's no state boards. God, I hate that. I hate when people say that. It's just why do you say that? It's not even true. And a lot of this information can be found literally on the association websites. Okay, literally on the association websites. So never fear. The credentials are good worldwide. All right, and they are, it's just keep maintaining them. All right. As far as working overseas, some people have said that, well, Blue, I want to retire and live in another country. That's really not allowed, because while I don't know every company in the world, I do know that there are a lot of companies that have remote workers that do require you to be in the United States, because when you live in another country, there's different rules, okay, when it comes to like taxes and things like that. So that's something that you have to keep in mind. This is not something where you can just travel willy-nilly and just go here, go there, and oh, I want to live in an RV and I want to travel and do medical. No, guys, no. Because a lot of times they want you to be within a certain radius of where you have to, where the facility is. And if it's not, they want you to be available during a specific time zone hours. So if you live on the Pacific Coast and your company is based on the East Coast, they're going to want you to be working based on East Coast hours. All right. So that's something else that you have to keep in mind. Your internet connection has to be secure. And for some reason, it upsets people because I always get the messages afterwards. Oh, well, yeah. Okay, guys, I'm just telling you what I know. Okay, I've worked remotely before, twice. All right. And it's no picnic if you don't know what you're doing. Now, I was fortunate enough that I had years of experience before I started working from home. And the first time I enjoyed it, the second time I did not enjoy it. But when you work from home and you're a brand new medical coder, don't think that it's going to be easy, okay? Because the book is a lot different from the real world. When you get in the real world and you start working and you start seeing these providers with their different mentality when it comes to documentation, because some take the documentation very seriously, where other providers, you have to fight and argue with them in a professional way, obviously, but you have to really talk to them and really work with them in order to get them on board, because they're not always wanting to do that, okay? So again, if you're brand new and you have a question, you can't keep running back and forth to your supervisor or your lead, because they have things they have to do too. And that's the hesitation that a lot of employers have hiring brand new people, is that they have all these questions and they don't have the time to train them. This is why I tell new students that you still have to study in your books even after you pass your certification, because it doesn't stop, all right? It doesn't stop, because when you get callbacks for your job, right? Like whenever you're applying, they're going to test you. They're going to see if you have the competence, and they're going to see if you have the knowledge. So you want to make sure that you're ready. But a lot of people don't want to hear that. Guys, I'm just telling you, be prepared and still apply for those positions that are asking for experience anyway, all right? So again, working remotely is not for those that are brand new. That's just always going to be my advice. I don't care. I don't care, guys. I'm always going to say that, because I want you to be set up for success. Now, if you get hired on remotely and they say, okay, we want you to be in the facility for a month and then we're going to send you home, that's good. That's good, because at least you've got some kind of direction, versus not having any direction and just being thrown out and be like, okay, here you go. And then you have to figure that stuff out. Okay, so what we do impacts a lot of people, guys. I'm just saying, it impacts patients. And if you are not coding those things right, that patient's going to have to pay, or that provider's going to lose money if you select the wrong thing. I'm just saying, guys. So just something to keep in mind. And like I said, you have to have a secure internet connection. You can't be roaming around using Wi-Fi. You can't do that, guys. And if you're at home, you need to set up a area that is secure. And I know I'm going on another subject, but there's only so much of like, okay, we're not state boards that you could say. When you're at home and you set up your area wherever you're working, your monitors need to be facing a wall. Okay, so that way you're not, having, if your monitors are facing the other way, like an open room, and somebody walks in and they can see your monitor, I don't care if you have a teenager in the house, okay? If it's somebody that's old enough to speak and talk, and they look at that record, you just committed a HIPAA violation, okay? Because that person does not have a need to know. So that's something that you got to think about there, guys. These records have to be secure. How would you like it if somebody walked in and was looking at your medical record, your private information that was out there, whether it is, your yearly exam, or whether it is, notes on, mental health, you know what I'm saying? It could be anything. You don't want that. So you have to think about how the patient would feel. Again, make sure that your monitors are facing the wall, so that way only you can see it and no one can walk up behind you and look at what you're doing. Okay, that's just my advice anyway. So I'm gonna go ahead and wrap this one up. I know this was short and sweet, but there's really not a whole lot to say. We are not certified by the state. Please stop saying state boards if you're out there. If you see somebody saying that, correct them. Tell them we are certified by the association, not by the state, because people are going to get too confused, okay, when they hear that. I'm just saying. If you are still studying, okay, if you are still reading those coding guidelines, taking part in my 31-day medical coder challenge, which is reading the ICD-10 CM 2023 coding guidelines, great, stick to it. If you haven't, you can still join us, all right? You can still do it 3 times. That's still plenty of time because, you know, the goal is to be reading them 1 time per week, all right? We're at the beginning of the week. You can break it up into, you know, 5 pages a day if you're reading it from the ICD-10 CM manual, right? If you have to download it from the CMS website, which you can download for free, so there's no excuse, guys. You can download it for free. It's a little over 100 pages. I think it's 115 pages or so. And if that's the case, it's just because the font size is different. Just think about that, all right? And you can just divide it up however, you know, you want to do that. But take the time to read them, guys. It's going to make you a stronger coder. And that's the whole goal, is to make strong coders, not coders who want the answers just given to them. Or the coders who say, well, I don't know. Or the coders who misinterpret because somebody else told them, oh yeah, it's this way. Guys, do your research. I'm just saying. So, like, subscribe, and share, and I'll see y'all next time. Bye.